Welcome back to Open Line tonight. We are talking about getting our kids safely back to school during this pandemic. And joining us tonight is Dr. Amy Bono, a primary care physician here in Middle Tennessee. Dr. Bono, thank you for joining us and taking our callers' questions. I do want to remind everybody that it is Open Line. It is your chance to call in and have your questions answered tonight by a medical professional. 615-737+ is the number to call. And we have Leonardo who is waiting to talk. Leonardo, thank you for being with us.
Yeah, thank you to the listeners and the appreciative press and everyone that's associated with this talk. Dr. Bono, a question about evaluating, literacy and other contingencies inside of our education system. If the comptroller does recognize the state of Tennessee as a democracy, why double hockey sticks, would you ever slap shot children in the way of the word pandemic, ultra censored by the fact that we just had the equivalent of convenience store break-ins and all kind of rooting and raiding, and you expect natural transitions. I believe, Doc, I believe 5+. You deserve natural transitions into education or anything that you jump in your car for in the morning in the AM. Hopefully you've eaten good and had everything you need to digest, but you don't run out into a flaming fire saying, I'm going to calm it down once I reach it face to face. We all are a part of this. We all are in this together, but we are all not saviors. I believe in the safety and saving my kid definition, bleep everybody else's definition, but my kid's definition is so big it goes to the grown level, right, Doc? I think we all are kids in this. Why would we dare go down below our own self and say kids lower than us should be put in front of a pandemic and we're going to teach them book wise, face to face? You can't laugh that off. I'm sorry, Doc, but what do you think?
Well, I do think that classroom behavior tends to mimic adult behavior. And I'm not an educator. I do have educators in my family that I'm very worried about. But I do think that we as adults need to do better if we expect our children to be educated in our society. And so I do think that we adults need to be better models for our children. I guess.
Dr. Amy, are you still with us? Dr. Bono, I'm sorry, we might be having some technical difficulties. Okay, good. I can at least still hear you. I'm not sure we can. There you are. Fantastic. You froze just for a second. It happens with technology. Okay. The very technology many of our kids will have to use to learn this year. And it doesn't always work, and it doesn't always work for kids in learning. I mean, that's a sad fact. I did want to ask you about this. I was watching one of my friends on Facebook posted video of her Board of Education's meeting last night. It's actually the county I grew up in Kentucky, Oldham County, and she posted her family's pediatrician speaking in front of the board. And he actually is the only pediatrician and child psychologist in Kentucky. And he was thanking the board for still offering in-person classes in Oldham County. And he has 3 kids who go to public school. And he was saying, because he is one of few people who is still seeing children right now, as many people are coming in for their well checks, that in his practice he has only seen 3 kids with coronavirus who have had fevers and headaches. But many of his children that he has seen has come in with clinical depression and suicidal ideologies, and they were mentally stable a year ago. So as a physician, how do you handle that aspect of this crisis?
Right. Yeah, I frequently talk to my patients about how, we are all, you might not be sick with coronavirus, but you're definitely sick in some other way, So the virus does affect you, even though you might not have it, the virus does affect you. And so, yes, our mental health is something that is greatly impacted by the crisis that we're experiencing. I would also say that part of school is creating stability in the family life. And we do need to recognize that. The sad thing is that, given the experience of several other school systems, I've referenced the Alcoa Middle School, I've referenced the Oak Ridge school system here in Tennessee. But should we put our kids back into school, we will experience like periodic classroom closures. We will experience possibly closures of entire schools. I can't exactly predict that, but I think it's reasonable to think that we're going to create instability in the life of children, introducing them to school in the middle of a pandemic. So I know that we are desiring stability right now, but the only way that we can get to that stable state is we have to get rid of coronavirus. That's all there is to it. We have to control the virus first.
How long do you expect coronavirus to be around?
I'll have to throw that one up to Dr. Fauci. I don't know. So, I will tell you that I think masking should persist through next cold and flu season. Typically cold and flu season would, maybe be September until March, April or so. So I do think that masking behavior does need to persist for at least that long. I don't know. I think
should kids be wearing masks all day in school? From the little guys to the seniors in high school?
Well, I will tell you that my 2.5-year-old can wear a mask. It's like potty training. You can do it. In terms of like the CDC recommendations, I lean on them. So the CDC does recommend a cloth face covering for folks that are 2 years and older. Whenever it comes to the American Academy of Pediatrics, their recommendations do encourage mask wearing during schools. In their recommendations, they do make some concessions that it could be more difficult for elementary school age children to wear a mask appropriately, but certainly middle school and high schoolers are more than capable of wearing a mask and being kind to their fellow man at the same time.
Let's talk about some things that I don't think a lot of people understand when we start throwing out numbers and terms when it comes to the coronavirus. First, let's talk about positivity rate. Can you explain that to people when we're looking at a positivity rate to be less than 5%? What numbers are being crunched? I think that's important for people to understand.
Yeah. So basically, whatever sample you have of tests, it's the amount of positives that you get out of that batch. So like if you test 100 samples, then if you get 5 of them positive, then that's your 5%. So currently in Tennessee, we're seeing double that. We're seeing approximately 10% of those cases come back positive.
And it's important for folks to know that we are looking at those numbers on a daily basis. That's really telling us the trend. When we look at the tests that come back positive and the tests that were reported to be given, that's what we're looking at. And then the transmission rate, can you explain that in layman's terms, what we're looking for there?
So it's just the prevalence. It's more like the disease that's in our midst, if you will. So just we assess the transmission as the disease that's in our midst by these values, these numbers of positivity rates, and this big 10 new cases per 100,000 persons per day. So
there has been guidelines.
It's just community spread.
Sure. There have been guidelines given by the governor. Also, districts are creating their own guidelines, so they can differ when it comes to what will happen in a school if a student reports or a family reports the student has coronavirus or has been near somebody with coronavirus. As a physician, I'd like your opinion. If my child goes to school and I get the text or call saying someone in your child's class has tested positive or has been quarantined for coronavirus, what as a parent should I do? Do I stop sending my child to school? If I have the option, they may tell me you can't anymore, for 14 days or 10 days. But if I have the option, should I?
Okay, so it kind of depends on how close of a contact your child is with to that index case. So the big word is index case. So if your index case is a positive, if your index case is confirmed as a positive, meaning sick child,
with the virus,
get the test and it's positive with the virus, then you have to look at the close contacts. The way that I've kind of described things is in terms of degrees of Kevin Bacon.
Right.
So, like, okay, you've got Kevin Bacon. How many degrees of Kevin Bacon are you? And so really you start looking at, the close contacts, and close contacts are typically defined as, in terms of time and space. So, how long were you around, that whole 10 minutes approach. And then were you within 6 feet of the person and things like that. So you look at the index case, you look at how close you are to the index case using the variables of time and distance. And then ultimately, if people are wearing a mask, your risk of transmission goes down significantly. So, you should honestly look at mask wearing as a way to keep your school open and be there to serve your individuals. So like, if there's a reason to wear a mask, is that it kind of cuts down on the severity that could result from having an index case, But I need to be clear. When it comes to, as I've talked to teachers, like I initially approached this as, okay, well, you just put a mask on everybody, it'll be fine. And that's not the case. Like, the school systems are limited by time, by space, by money. And as a society, we've just underinvested in our public health educational system. So, whenever it comes to ramping up a school to be serving its students in the midst of a pandemic, we have a lot of limited resources. And I don't know that we have enough resources to fight coronavirus and educate our children.
Let that one sink in for a little bit. Let's talk about what parents should be on the look for as far as symptoms go. I mean, it seems like that list of symptoms has really grown. It started off with 3, I think, and now it seems like your eye twitches and it could be a sign. But what would you tell a concerned parent who calls in? What do they need to watch for?
Okay, so number one, I'm not a pediatrician, but I am a mom. So when I think about illness in my own child, I think about changes in temperament. And I, just if you get your mommy gut feeling is a very important thing to find too. It's the same feeling that you get as a doctor to know who's sick and who's not sick. So yes, you should look for fever, but in children, that's not often a presenting symptom. You should look for malaise. You should look for, cough, difficulty breathing. You should look for possible diarrhea. There's all sorts of manifestations like dermatologically of rashes and, the famous COVID toes, if you will. But I think you have to look at it as like, okay, well, it could be a cold too, just runny nose, so, it could just look for cold symptoms.
And for any parent who has child-age children, you call it snot timber when all the kids get back to school because everybody exchanges germs anyway. So it could be a very interesting August and September. Okay, we have to take another quick break. I want to encourage people again. We have one more big segment coming up. It is your chance to call in with your questions for a medical professional about coronavirus. We're 615-737+ is the number to call. We're going to come back right after this.